as you can see, I have someone special here with me. Help me or join me in welcoming Lady K of HealthPlugMe. The one and only nurse, Olori HealthPlugMe. Cash Madam.
Hi everyone.
Cash Madam.
It's okay. Hi everyone. My name is Lady K of HealthPlugMe.
It's not easy.
What is not easy?
It's not easy. You sabi.
So I know so many of you might have been hearing my name, and if this is your first time of seeing me or coming across me, my name is Lady K of HealthPlugMe. If you have been trying to get pregnant or you have been having some issues concerning conception, pregnancy, infertility,
yes,
this is the best plug for you, I'm telling you. So we are here on this show today to enlighten you more about women's health and to tell you some things you might not know about women's health.
Okay. So guys, you see, I didn't even have to do like too much introduction. The Olori HealthPlugMe did justice to it all. Like she said, we'll be discussing about women's health, everything women's health. So that, I mean, you guys, I'm so sorry guys, like to the guys, I'm so sorry because this podcast is not for you. But basically, in another sense, indirectly, the podcast is for you because obviously you have girlfriends, you have wives, you have babes or side chick, and if you want the best for them, stay tuned so that you can, I mean, enlighten them by watching this. So like, it's still also for you guys. So yes, welcome ladies and gentlemen, sit down as you all will be enlightened by today's discussion. As you can see, I am here with my podcast book. For me to be here with my podcast book, it means we are on a hot seat. I mean, this discussion go long, and you should be ready for it. All the questions here for you, Lady K. Are you ready?
Yes, we
are
you
ready?
We are ready.
Okay. So, Lady K, first question here is, what are some of the common misconceptions about women's health that you encounter in your practice? Let me break it down. What are some of the incorrect opinions about women's health that you've seen in your practice that you know that yes, this thing is wrong, this is not how it's supposed to be? And as a sabi woman that you know, please enlighten us the more.
Okay, thank you so much.
You're welcome.
About that, I've been doing this work for more than 4 years now, and I've seen a lot of women that has been misled because of one or two things they hear. Some of them do not even ask for opinions from medical practitioners.
Really?
Yes.
Wow.
So one of it is self-medications.
Yeah.
So because
true.
when you are trying to get pregnant, you see a lot of prayers from everywhere, from your parents, your in-laws, your husband, or from everywhere. So you believe anything you want to take, you can just take it, and you are always eager to take anything you see.
Yeah, true.
So, and you see some women, they will be like, oh, Chioma took this, it worked for her, then I have to take it. No.
Wait, let me hold you right there. You just mentioned Chioma. That means you're a Davido fan.
Yeah.
Continue.
So I'm just saying, everybody should say no to self-medication because first thing you have to know is know the causes of the infertility, or let me say, know the reason why you have been battling with infertility.
True.
Normally, a woman that is very okay medically, you are not supposed to have issue with fertility stuff. But if you notice it's been more than 1 year you have been trying to get pregnant, it's not working for you, what are the things you are supposed to do?
Yeah, like
go for medical checkup.
Yes.
So one of the mistakes most women make is they don't even go for checkup anymore.
Wow, because they feel like they know best.
They feel like,
for them. They know
this thing worked for Taiwo, then it can work for me. Truly, it can work for you.
Are you guys hearing?
What if Taiwo's problem is hormonal imbalance and you are having blocked fallopian tubes? It's possible. So if you notice that you are having, or let me say you are having fertility issues, the first thing you should do is to make sure you go for fertility checkup.
Wow.
Go for HSG, hormonal provide test, go for pelvic scan, transvaginal scan. This test will help you to know where your fertility problem is coming from.
Wow.
Now, let me tell you one of the mistakes most women make nowadays.
Okay.
Maybe it's due to our tradition. Most women believe that, or let me say in African culture, they believe if couples got married and they find it so difficult to get pregnant, they believe the problem is coming from the woman. Like,
Sure.
who told you that men do not have fertility problems? Do you know that if you put
Yes, so it's not only women that actually serve. It's true. Please continue. Right on.
do you know if you
Uh-huh.
put, like, let's say 10 couples are trying to get pregnant, you understand, right?
Yeah, I get you.
Now, out of those 10, if the 10 are having fertility problem, do you know out of those 10, 3 or 4 men can be having fertility problem out of the 10? So the
Yeah,
remaining
that's
6
true.
or let me say the remaining 5 or 6 can, maybe the problem might be from their wives. So because you've seen a lot of women that have like they have gotten married, and it's been so hard for them to get pregnant. Some will even be telling you that, oh, you have, damaged your womb
I
before
know,
you get
right?
married. You have,
Mother-in-law will be
yes,
disturbing the wife. Rubbish.
before you get married, they believe you have aborted. They even removed your womb. That's not the case. Do you even know more about hormonal imbalance? If hormonal imbalance deal with you, even as a virgin, for 10 years you might not be able to get pregnant, even when you have never had sex before. So I'm just saying this: self-medication and always thinking the problem is coming from the woman is one of the
Yeah,
misconceptions.
both parties, both the
So
guy and
if
the
you are
lady,
trying to
they
get
have
pregnant,
check
both
themselves.
you and your husband should go for the test. So many men nowadays, they are having sperm problem, they're having hormonal
I
imbalance.
guess.
Do you know that men do have hormonal imbalance?
Yeah.
Men do have hormonal imbalance. So why do you think you should always be putting all the blame on the woman? So this is just to tell every woman out there, fertility test is very important for both you and your partner, not only you alone. Because if there is any problem, that is one of the few things I've encountered in women trying to get pregnant. All of them, they always feel as if the problem is coming from them. Most of them, they don't have enough knowledge to know that fertility issues come from men too.
Yeah.
And most of them, they are always running after self-medication.
True.
So that is just what I can say about it.
Wow. That was a lot.
Yeah.
Men and women, you heard that. Go for medical checkup. Everything is not all about women. I don't even know why everything is always women. Even though we used to say women have the most problem, but seriously, both parties need to do checkup if you want baby or babies. Moving on to my next question. How does hormonal imbalance affect a woman's well-being? And what are the signs of hormonal imbalance? Because some people have hormonal imbalance, but then they don't know. They might just feel like it's a normal thing that is wrong with them. It is not hormonal imbalance until probably like they've been trying to conceive and they see they are unable to conceive before they actually go for checkup and realize that, oh yes, they do have hormonal imbalance. So like, what are the signs that will make one know that yes, he or she has hormonal imbalance?
Okay. Most people do not know what hormonal imbalance is. Now, before we go into the symptoms of hormonal imbalance and how it affects people, let me tell you what hormonal imbalance is.
Okay.
Hormones are the body messengers. They are the body signals.
Okay.
For instance, as a woman, we have some fertility hormones in the body.
Oh,
If these hormones are too high, then it can
Yeah.
affect you.
Yeah.
If they are too low, then it can affect you.
Yeah.
Let's make an example. Prolactin hormone is the hormone in charge of breast milk. So if this hormone is too high, that is when you see that a lot of women are having nipple discharge
Yeah,
when they are
true.
not breastfeeding a
True.
baby.
Yes.
So you are not pregnant, you are not breastfeeding a baby, and you are having nipple discharge. This could be a sign of hormonal imbalance if there is high level of prolactin in your body. So these hormones are the body signals. They are the body messengers. So if these body signals, or let me say, if the body messengers are, if there is an increase, maybe unusual increase, or let me say unusual increase in the level of the hormones,
Okay.
then you can be experiencing some symptoms you are not supposed to be experiencing. It means something is wrong with your body, something is wrong with your hormones, which you have to do something about.
Wow.
So that is what hormonal imbalance is.
Is it that the breast should just be
It will be leaking out water as if you are
without you
breastfeeding a
pressing the
baby.
boobs?
Some people without pressing, some people when they press or when they wear bra, their breast will be leaking out water.
Wow.
Yes.
Wow.
So this happens to some women, and most of them do not even know it. Most of them do not even know how to go about it. Most of them do not even know they are having nipple discharge. It is only when their husband or their partner suck their breast, their partner will now be noticing something is coming out like water. So as a woman, it is very important for you to do what? Make sure you study your body very well before you start your period. during your period, after your period. Make sure you do what? Study your body.
Wow.
Massage your breast very well. I'm not saying you should go and give it to a guy. No. Do this yourself.
Wait, so how are we supposed to massage our breast? Usually like this.
Yeah, we have some ways you can actually do that. You can do it in a lying position.
It was in a lying position.
If you lie down, yeah, you can try to massage it from the side, from the round position. You use 3 fingers, these 3 middle fingers, to to massage it very well. If you notice any lump or you notice any discharge from the breast, then you should know something is wrong. And mind you, nipple discharge does not only signify high prolactin or hormonal imbalance. It can signify breast cyst. The same way women do have ovarian cyst, we have breast cyst. So if you notice you are having nipple discharge, go to the hospital or to your lab to go and run prolactin test, and you do breast scan. Breast scan will show if you are having any lumps, or there is something like maybe you are having lumps, and either it's cancerous or not, they will know. And breast scan will show if you are having cyst in your breast, and if yes, what you can do. The doctor will be able to tell you. And if it is high prolactin, your prolactin test will show if your prolactin level is within the normal range or not. So this is the reason why, if you are having nipple discharge, don't always think because your sister or your friend is having nipple discharge, she used cabergoline to treat it and she was fine. So that does not mean you are having high prolactin. You might be having breast cyst or some other medical conditions, even cancer of the breast. So if you're having that, make sure you go for your checkup. It is very important. So that is one of the form of hormonal imbalance which I talk about, which is high prolactin. So now the symptoms. Let me talk about the symptoms of hormonal imbalance she talked about.
Yeah.
Now, the hormones that is not balanced will determine the symptoms you might be experiencing.
Okay, explain for
like I said earlier, we have different type of hormones in the body.
Sure.
We have prolactin, we have LH, we have FSH, we have progesterone, we have estrogen.
Yeah.
We have different type of hormone in the body. And mind you, you see these hormones, they have different work they do in the body, different benefits. This is the reason why you see some women, when they have low progesterone, they miss their period for a long time.
Yeah,
you see some women, they will be like, Lady K, I've not seen my period for 6 months. For 1 year, they might be having hormonal imbalance. So that is the reason why most women have issue with their period. They are having period irregularities because of these hormonal problems. So one of the common symptoms of hormonal imbalance is irregular period. If you are having irregular period or you are having irregular cycle, you have to go for hormonal provide test, because this will help you to know the hormone that is not balanced and how to go about it. It will help you to determine if your irregular period is being caused by hormonal imbalance or infection, PID, or any other thing, or medical conditions. So another symptoms is anovulation. What is anovulation? Do you know that?
I don't know.
Okay, everybody.
You are teaching us now, so teach us.
Everybody knows that ovulation is when a woman when your ovary produce an egg, and the egg is being released from the ovaries, right?
Sure. Yes.
Now, anovulation is the opposite.
Are you serious?
Yeah. During anovulation, you might experience your period. I mean, your period will come out. You have flow, but you will not ovulate.
Okay.
So it is the period and absence of your ovulation. So to you, so many women that will be saying, I'm not having any problem, I am okay because I see my monthly flow every month. My dear sister, you might be having that monthly flow and be having problems. You might be having monthly flow and be having infertility issues. So because you are having your monthly flow, it does not guarantee you that you are medically fine. So when you are having your period and ovulation does not take place, that is what we call anovulation.
Then anovulation, is it normal?
It is not normal because it is an incomplete cycle. A normal cycle, when you see your period, right, you are supposed to ovulate at the middle of the cycle.
Yeah.
Then you see your period again if conception does not take place.
Sure.
But an incomplete cycle, you see your period. Ovulation, you are supposed to ovulate.
Okay.
Because conception has not taken place, you understand?
Yes.
You are supposed to ovulate and ovulation will just cease. So it means that cycle is never complete.
So that's it. And ovulation is also part of hormonal imbalance.
Yeah, it's one of the symptoms.
Yeah, one of the symptoms.
Yes.
Wow.
So
I'm
that's
just hearing
one of,
that for the first time.
that's
like,
one of the symptoms of hormonal imbalance. Why some women, that's the reason why some women do not know they are having hormonal imbalance, because they believe, oh, I see my monthly period, I'm not having any issues.
Women are going through a lot. We are indeed going through a lot. If you have a babe or you have a wife and you're not treating her right, you are wrong. You are fucking wrong. Treat your babe or your woman right, or treat your wife right, or all these things. Hey, the DK continue.
So now I will talk about the common symptoms of hormonal imbalance, and one of the symptoms is acne. So many of you that do have experienced acne, like in your face, so rough every time that you have used so many things, is not working. My dear sister, hormonal imbalance could be, or let me say PCOS could be the reason why you have been experiencing that. If you notice that you have been having acne on your face, you have been taking a lot of things, it's not working, using a lot of products, is not working, even natural products is not working, and it keeps coming out, go for pelvic scan and hormonal provide test. It could be a symptoms to hormonal imbalance or PCOS. So another symptoms is anxiety and depression. Do you know that if you're having hormonal imbalance, it can affect you psychologically?
How?
Yeah, because these hormones we are talking about, it will just be going up, be coming down. It will make you to have mood swing. Even so many, that's why you see some women when they're on their period, no man can. Anytime they're on their period like this, if somebody pass like this, they can knock you.
True, some people are like that.
I'm
know
telling
somebody.
you. So any
I'm
small
not sure
thing,
interested in.
they get hungry. Any small thing, they get hungry. It's not their fault. It is the work of those hormones.
Yeah.
So when there is a rise in these hormones, it can affect them. It can be making them to be having these psychological issues. So anxiety, depression, mood swings will be setting in. Even during some women during their period, or let me say when they are having PCOS or hormonal imbalance, they have issues with their man or their friends during that time.
Wow.
Yeah, they have more, like they have issues with almost everybody
because of
the hormones in the body. So it is not really easy. It is not easy. So if you notice you have been experiencing anxiety, depression, you are smiling now, in the next 2 minutes you switch to another kind of mode like anger, then something is wrong. Something is wrong. It is the high time for you to go for hormonal provide test to check if you're having hormonal imbalance.
So me like this, I should go for hormonal provide test.
You have to.
But wait, all these tests used to scare me. Hope they will not choke anything inside my body.
No, they will just collect your blood. If you want to go for hormonal provide test, they will just check your blood.
Okay, only my blood.
Yeah, they will take your blood.
Because I don't anything injection or putting something in my vagina. No.
On the second day of your period, they collect your blood. They will test some other hormones like prolactin, estrogen, and all. But on the 21st day of your cycle, that is when you do your prostate.
They will just collect my blood.
Yeah.
And at the same time, when I'm on my period, the second day is when they will also collect blood.
No, this is how you run hormonal provide test. On the second day of your period, they will collect your blood. There are some hormones that they will check on.
So it's not just
day.
Normal blood, it has to be period blood.
Yeah, during your period. So on the 21st day of your cycle, which is, let's say you start your period today, then on the 21st day, they will collect another blood to check your progesterone level.
Sorry to cut you short. Like, how would they take blood? Is that the blood from my vagina?
No, from any part of your body.
Because when you say on my period, I'm really thinking.
No. You know, a lot of women do not know how this happens, right?
Yes.
The reason why they collect your blood during period, let me explain to you.
Please, right on.
Okay. When you are about to see your period, right? Do you know it is your brain that sends message to your, like, a message was sent to your brain that this person, the body is getting ready for period. Yeah. So there should be an increase in this hormone. So we have some hormones in charge of period. We have some in charge of ovulation, breastfeeding, and all. You understand what I'm trying to say now? So during your period, some hormones are meant to be high.
Yes.
After your period, some hormones are meant to be high or to go down. During your ovulation, some hormones are meant to go high. This is the reason why you see some women when they are reaching menopause, you see this progesterone hormone, estrogen hormone, all these hormones in charge of period and ovulation, they will keep dropping.
Yeah.
Because they are reaching menopause already.
Yes.
So that's when you see some women that are approaching menopause, they will tell them, oh, my period is no more regular, I'm not ovulating, the egg quality will be reducing. the egg quantity will be reducing because you are reaching that age where your hormones are dropping. So now, immediately your fertility hormones are dropping. There are some hormones in charge of your menopause that will be going up.
Yeah.
And this
very
hormone
true.
will now be suppressing your fertility hormones. People that are experiencing early menopause,
Yes.
that is the reason why you see that it's very hard for them to get pregnant, because their fertility hormones are dropping.
Yeah.
Yeah.
That's why they have to get pregnant early.
Early, at the early stage, or else it might be hard for them to get pregnant.
And that's why
again.
it's actually good to know. That's now I see why it's good to go for profile tests.
Yeah, it's
because
very
you need
important.
to know if you're going to enter menopause early or not, and to know if your hormones are balanced or imbalanced.
Yeah, it is very important. And another test that is very important is AMH. AMH test is very important. It will help you to know how many eggs you have left and if your eggs are in good quality form. This test is very important.
AM what?
AMH.
AMH.
Yeah.
Wow. Like, this is really enlightening. But then I have like tons of questions. Not tons, but couple more questions for you though.
Okay.
So there's this trend that has been like going on, like the okra trend. I'm sure you all know that because I watch your TikTok page and I legit see it on your TikTok. Use cinnamon, use okra to be wet down there to be. So what do you think about it? Like is it actually legit? Does it work?
Okay.
Because a lot of you, because me, I don't like to be mixing different things. You have to tell me, like, I cannot. It's even weird drinking okra. Ew! What? I still prefer what's this one called? The cinnamon than the okra. I can still drink cinnamon, but you see okra water. This no.
Okay, let me talk about the okra, cloves, and cinnamon recipe. First thing I want you to know is that cloves and cinnamon and okra works for hyperovulation. If you are not ovulating, let me say you are trying to get pregnant or you are not ovulating well, okra, cloves, and cinnamon will actually help you to boost your ovulation. Even if you are having hormonal imbalance or you are having some medical conditions that is making you not to ovulate or to experience an ovulation, then try this recipe out. Now, another thing okra and cloves and cinnamon does in the body is it helps to boost your sexual urge. Yeah,
but I think another one is tiger nut. Tiger nut still helps.
Yeah, it helps. Yeah, it does. So if you know that you are trying to get pregnant or you are trying to boost your ovulation or you experience vaginal dryness, you don't have urge for sex, or you always dry down there, cloves, cinnamon, and okra works better.
Is it only for women or for both men and women?
Men can take cloves water too because it has a lot of benefit for men.
Yeah, but
but I recommend it for women the most.
Yeah,
because we are the one that is having hormonal imbalance, PCOS, and some other problems that is hindering us from getting pregnant or from ovulating.
Wow.
If you check out my TikTok page, you've seen a lot of women that have testified about it. So it really works. It really works.
I feel like that's really like the latest trend going on because I'm in a group, a women's group.
Yeah.
And somebody else still posted it that drink this thing and she drank it and she was wet down there. I'm like, group chat.
It's really very nice. I'm telling you, it's very nice. If you have not been getting wet, if you have not been getting wet, right? Try the okra, cloves, and cinnamon. It works, seriously.
Like how would you do it? Would you like blend okra, cloves, and cinnamon together, or how is it going to take it?
I don't tell people to use the powder one. But there's a way I teach them. You get the raw cloves, cinnamon, and the okra. Then you take your 3 spoons of cloves and 3 cinnamon sticks inside 2 liters of bottled water. You fill it with water, then you soak for 2 days.
Okay.
Then let's say you want to start taking today. Then you slice 2 okra inside a cup. You pour maybe half a mug of your soaked cloves and cinnamon inside. Then you cover it for a few hours, let's say 3 or 4 hours. Then you sieve it before you drink it.
I hope it's not going to make them urgy. Not more that they'll go and drink and they'll start becoming honey.
It works for that too.
Oh,
yeah.
So it's multi-purpose.
Yeah, I'm telling you, it works for that too.
Okay. Ladies and gentlemen, besties, hey, I hope you are hearing. If you want to do, women, if you want to be wet down there, wives, if you want to be wet down there, mix it though. For people like us that are very innocent, I don't know what she's talking about though.
You don't know what I'm talking about.
Okay. So moving on to my next question. How can women navigate the challenges of reproductive health, because it's very paramount that a lot of women are unable to give birth or are barren. And from knowing you and your work, I mean, that is the main of your work. And I see that you've helped a lot of women to like get pregnant. So like, I mean, how would you help women to go and navigate these reproductive challenges?
Okay, the first thing I would love to tell people, like I always try to let people know, like people that have known me very, very well, they know this. Anytime you come up to me and say, "Ah, Lady K, I'm trying to get pregnant, how can you help me?" My first question is, which fertility test have you done? Because a lot of women nowadays, what they do is they compare themselves to other people.
Yeah.
So because, like I said, Taiwo took cloves and cinnamon, she got pregnant, it worked for her. Does not mean it is going to work for you. Because your own problem might be different from our own problem.
Yeah.
So the first thing I would love to tell people is always make sure you know where your problem is coming from. Be able to determine this is what your problem is. Go for medical checkup. Make sure if it's PCOS, then you know, okay, it is PCOS that you are battling with. You'll be able to know how to tackle it. If it is blocked fallopian tube, you'll be able to know it's blocked tube. Not that you'll be taking PCOS or PCOS medications
For
to treat blocked fallopian tubes.
Yeah, that's why it's important.
So that you see that point alone is really very, very important for women. And another thing is don't always listen to what people say, because
Okay.
you listening to what people say might actually make you to be depressed. It might make you to it can make you to give up on yourself. We have seen a lot of women that will be like, oh, I don't want to do anything again, I'm tired, because of what they have been listening to. Like they have been hearing a lot of things that people are saying. They give up on themselves. So keep doing what you are doing. Make sure you do your fertility test. Don't give up on yourself. Keep being positive. Another thing is prayer. Don't ever joke with prayer.
Yeah, prayer
Prayer
is very
is the
important.
key. There's nothing that can happen to you without God.
Yeah,
I mean,
so very important.
there's nothing God cannot do.
We put Jesus on this platform,
So
people.
always put him first. Make sure you pray.
Yeah.
Make sure you pray, because prayer is the key.
Yeah, that's very good. So like, what are the what's it called? What are the fertility tests? Because I mean, you mentioned PCOS, you mentioned hormonal imbalance tests. Like, are they just two or there are more?
No, if you're having hormonal problems, or let me say you're having fertility issues,
Yeah.
there are a few tests I recommend for women to do. The first one is
Okay.
pelvic scan.
Pelvic
Pelvic
scan.
scan will help you to check your womb. If you're having fibroid, pelvic inflammatory disease,
Yeah.
that is the infection that spread inside your womb.
True.
And if you're having PCOS, pelvic scan too can detect that. If you're having ovarian cyst, it can, like pelvic scan can help you to detect these problems. So it is very important. So pelvic scan can actually help you to determine this. So another test is transvaginal scan.
Okay.
They will put something inside your toto. What is it? There was a lady I recommended that test for. Do you know the husband did not allow her to do it? The husband was like, why would they put something in my wife's vagina? Like, for what? It is only my thing that must enter that
That
place.
is very uncomfortable. I'm even touching my vagina because that shit is very uncomfortable. I mean, like, I legit cannot wear tampons. I hate tampons because it's like, I don't like injections normally. But then hard girl, you won't take injection. Like, I will not cry, hard girl, but injections, I don't like injections normally. And tampons to me is like you inserting injection. No, not prick.
It's
Like inserting injection inside my vagina,
Which one is
guys.
injection?
That's how tampons look like to me. People that use tampons, shout out to you guys. I'm not condemning you guys. I'm just saying, me personally, I cannot use tampons. So like, you're not telling me to do this other test. You're not insert. Hey, Jesus Christ.
There's an object.
Hell
it is
no.
very long. They insert the
God forbid,
condom
I will not
on
have
it.
issues.
They insert condom on it, then they will insert it in your vagina. This test will help you to check your womb tissues. Everything is going to be shown. It is more clearer than pelvic scan.
Are you
because
serious?
They do it from inside. Pelvic scan is from outside, right?
Okay.
But this one, they do it from inside.
Hey.
So it helps a lot of women to know if they're having so many other issues. And I advise women to go for more like of transvaginal scan than pelvic scan. So another test is hormonal provide test. Hormonal provide test will help you to know if you're having hormonal imbalance, and to check if truly you're having hormonal imbalance, which of the hormone is not balanced.
Yeah.
Some of you are having hormonal imbalance, you don't even know the hormones that is not balanced. But because you have been told you're having hormonal imbalance or you're having symptoms of hormonal imbalance, but still you don't know you don't even know the hormones that is not balanced. So hormonal periodic test will help you to determine that. Make sure you go for it if you're having any symptoms of hormonal imbalance. Another one is AMH. Like I said earlier,
Yeah, you said AMH.
AMH will help you to know your egg quality and quantity. It will help you to know your remaining egg count. If you still have enough egg for conception, or maybe they will advise you to go for IVF.
Yeah.
Now another test is HSG. Hey, this is the mama babe.
HSG.
HSG will help you to know if your tubes are blocked or not.
Oh, you know your fallopian tube.
Yeah.
That's what HSG.
Do you know there are some people that are having fibroid inside their fallopian tubes?
Are you?
Yeah.
You can have fibroid.
Inside the fallopian
somebody
tubes.
can have fibroid.
Yeah.
Wow.
So how can you detect that through HSG? You might not be able to detect that through pelvic scan because of where it is. But if you do HSG, it will help you to determine where it is, or let me say the location of the fibroid. If you're having blocked tube too, how severe it is or how made it is. So those are the tests I always recommend women to go for. And for men, let your husband go for semen analysis test. Semen analysis test will help him to show the sperm morphology, sperm motility, sperm count, and everything about his sperm. Either it's fast, either it's watery, the color, and every damn thing. Most of the men working around nowadays, most of them are having fertility issues, but you might not know. So please and please make sure you go for this test if you are trying to get pregnant.
I cannot recover from the fact that somebody will put something inside my God. See, I am very capable. My fertility is fertilizing. I don't need any test. Aside normal with profile test, that one. But the one that somebody will say,
no, you
God
can do
forbid.
pelvic scan too. It's from outside, not from inside.
I see, my body is fine. Lórúkọ Jésù. I confess positive things. I am not. Wait.
What is it?
I'm imagining it and it's doing me strong.
It's not big actually. It's really very,
from
very
what
small.
I read, it is painful. And somebody, even one of your fans, I mean TikTok, yes, fans, one of your fans commented on your TikTok that the aftermath is very painful.
No, that is HSG. HSD, they will have to, insert dye inside your vagina to your fallopian tubes. They have to see everything from your vagina. There's a way they will connect it, right? So the transvaginal scan, it's what they are going to insert in your vagina looks like a stick like this. So they are going to insert it in your vagina. They will be, checking everything from inside your womb. So
hey, Lady K, have you done? Don't worry, we are normal. We are normal. We only need to go and check normal tests. The one that they mean.
A lot of women are having issues nowadays, and so many of them, I really pity them because it's not easy to be a PTTC mom.
Yeah, and a lot of
easy.
women do not know about these things. That's why I brought you here, because me myself, I'm personally learning from you, because I don't know about transvaginal. I'm just hearing that for the first time, and with anal ovulation, I'm just hearing that for the first time. So that's why I brought you here, to enlighten us more. Which brings me to my final question.
Okay.
What made you say yes, I want to go into women's health? What brought about you starting your business, HealthPlugMe? Like I want to know what happened. Like, you cannot just, it's not normal for someone to just say, yes, this is my passion, I just want to do this. Aside the fact that yes, nursing is your passion, but nursing aside, your main passion or your main focus is women's health. So what brought about you making up to your mind to yes, this is what I want to do, this is what I want to major on? I mean,
I understand your question, and thank you so much for that question.
You're welcome.
A lot of people have been asking me same questions, but I have never given them an answer.
Wow.
Because
I'm honored that you want to answer me. I feel special, man.
Okay, now let me tell you this. Let me tell you, when I was small, I know a lot of my followers, my fans, do not know what I've experienced as a teenager. I have experienced hormonal imbalance before.
Wow.
During that time, I do bleed. I do deep period for 28 days, 30
28 days.
Yeah.
Hey?
As a teenager.
Agba.
For good 10 years. You will not understand. For good 10 years, I was seeing my period for more than 4 weeks straight. And let's say I finished my period 3 days ago, I'll start another one today. So each time I see my period, they always admit me. I always spend my days in the hospital. What I'm saying right now, I have some friends
let me get something straight. How are you coping? Because literally you just said 28 days to do period.
Yeah, during that time,
That
I
means you
remember.
don't have rest. You only rest for like 2 days. Then the next after 2 days, you go back to your period
Do you
again.
know in a day I use 8 sanitary pads?
Eh?
Yeah.
Wait,
It got to a point I couldn't use sanitary pad
What did I
anymore. I
just-
started using clothes for my period.
Wow, that's a
So
lot.
I spend most of my days in the hospital. People that went to school together, right? I am very sure most of you can testify to this. Because even when I was in school, they always admit me every month to our school health center. Most of you can, like, you know about it, right? Even
Yeah.
some of my lecturers during then, they'll be like, oh, are you a sickler? What's wrong with you? What the hell is wrong? Even so many times I miss my tests, my exams, I write them in the health centers. So during that time, I keep asking myself, because my parents took me to a lot of hospitals, and most of them, they will not do any test for me. They will just keep giving me injections
Wow.
to reduce the pain. But the funniest part is that it does not reduce the bleeding, it does not stop me from having that pain, and it does not stop it from occurring the following month. So I keep experiencing that. Not until one day I talked to my school father about it, because he knew about it when I was in school. He now told me, why don't you go to FMC or go and see a gynecologist? I said no problem. So I went to to FMC. That was in Owo. I don't know if you know the FMC in Ondo State in Owo.
Yeah.
So I registered there. They gave me a card. I was able to see. Immediately I explained to the woman. The woman told me that, oh, you might be having hormonal imbalance. And this thing I've been battling with it for 8 years. No other doctor has ever told me that. You could imagine. So this is the reason why
there are doctors and there are doctors. We sabi. Go to the
Hi.
right doctors. Go to the right doctors, people.
So this is the reason why it is very important for you, if you are passing through something, make sure you know the kind of hospital you go to. You don't just go to anyhow doctors or anyhow hospitals or anyhow people that will just be giving you drugs. Immediately that day, that woman did pelvic scan for me immediately. She's a gynecologist. When she did, she was like, oh, you might be having hormonal imbalance. Let's run you some tests. That day, I didn't have any money on me. I called my brother. I called my school father. I called my school mom. So they all sent me money.
Yeah.
Because I didn't want to go back to school and
come
come back
back,
for the
yeah,
test, because I was
wasting of
really
money, like double
dying.
money.
Like doing period for four weeks, then the third or the fourth month I see another period. You know what it means? Using 8 pads in a day. Do you know what it means? A lot of women pass through this. So when they send me the money, I run the hormonal provide test that day, and I now told her, please, can you give me something that will make me to feel better? She gave me a drug.
Okay.
You understand? She gave me a drug. So she said I was going to feel better and it was going to reduce the blood flow and everything.
Yeah.
So when my result was ready, they called me and they told me it was hormonal imbalance, this and that. I took a lot of drugs. It didn't work out for me. I won't lie to you. There's this drug they used to abort, and it works to regulate hormones too. They use it for ulcer too.
Oh.
I took it so many times. My sisters, same thing.
Wait, did you say drug used for abortion?
Yeah, it has
Or
a lot
also-
of benefits.
Yeah, okay.
People, it is mainly meant for ulcer patients, and people use to balance hormones, but some people use to abort.
Oh, okay.
Yeah.
Now I get it.
So I used a lot of things. It didn't work out for me. Not until that was the reason why I now started. What I studied is, I'm in health line.
Yeah.
So, but still, when I noticed the drug was not working for me, I was like, is it that I'm not taking the right drug or what? Okay, let me try and dive into something natural.
Yeah.
If it was going to work for me. So from there, I started learning this thing online. When I was in school. We used to do a course in the hospitals and in the health centers. We call it practical.
Yeah.
So that was, instead of us to spend 2 hours every Wednesday, I go to the hospital every day, to the school health center every day, to learn from the doctors, from the nurses, and they were so friendly. They were putting me through on a lot of things.
Yeah.
So from there, I started learning from myself, like only with myself. And when I get home, I make researches online. People that are making herbs and all, I visit them, I talk to them. That was when I developed the interest. So while taking few of the herbs and other things, do you know that I started, using herbs, natural herbs for myself? Nobody recommended anything for me.
Wow.
Even sometimes when I'm sleeping, I would just imagine like, okay, what if I use something like this? So some people told me it was talent, but I don't know. So I'll just wake up, I would take the thing, I will use it, it will work. That was how
because
God
you
was.
you know the usefulness of it, so you just want to see if it will work
Yeah,
for you.
so, and making my researches online, praying and
Learning from different
eager
people.
to learn more. Just keep praying. I was so eager to learn more. That was I tried to make research about hormonal imbalance, period irregularities, and all. That was when I now started making, like, knowing a lot of natural recipes, visiting people that are into it. What does this one work for? And when I started using some things, I felt the relief. I stopped my bleeding reduced to like 2 weeks from 4 weeks. When I keep doing it, it reduced to 1 week.
Wow,
Yeah, now I see my period for just 4 days.
that's really good.
I'm telling you, I see my period every month, and I have 24 days cycle now, and it's very, very regular.
Wow.
I even do ovulate. So during that time, someone that is seeing period for 28 days, how do you want to know if you are ovulating?
I know. Honestly,
So when I talk
there's
to,
no breathing
like,
space.
when I talk to my people, like my school father, my school mom, my let me say my friends, like, this thing, they say, oh, wow, why didn't you? A lot of women nowadays, they are out there, they don't even know they are having hormonal imbalance. They don't even know they are having problem. They don't even know how to solve their problem. Why don't you help them? So that thing came up, and I was like, okay, let me just do this. Let me start creating awareness about women health, hormonal imbalance, fertility issues, and other things. So that was how I started. Immediately I started more and learning more about these natural recipes and herbs. That was when I now went to learn it. I learned from 3 different people.
Wow.
Yes, 3 different
Great.
people, and I took my time to do that, to make sure that I get my certificate. I'm certified. You understand? So till today, I still keep learning.
Yeah, learning is constant.
So assuming during that time, I knew there was something natural that was going to help me, I wouldn't have suffered for 10 years. Do you understand what I'm trying to say now?
Yeah, I get where you're coming from.
I wouldn't have suffered for 10 years before I was able to see solutions, before God.
But they say experience is the best teacher.
Yeah.
If you are not experienced it, you will not be where you are today and doing this business. I mean, so it's good in a way. Every disappointment is a blessing. In a way, it's good as it happened to you, because now you are creating awareness, enlightening people that don't know these things out there.
So this is the reason why I went into the business. I went into the content, letting people know what is wrong, what is right. If you're having these symptoms, it is a no for you. If you don't have these symptoms, if you're having these symptoms, it is right for you as a woman to see the signs and symptoms. But if you are having some kind of symptoms, I'm letting you to know that they are not meant for you to be experiencing. It is not good. So this is the reason why I went into it.
Wow.
Because what I went through, I don't want other young ladies to go through the same thing.
Wow, that's really good. Show us your product now. I want to show my people. My people have to see. They have to see. It's not about talking, it's about the work alone.
Okay, guys, so this is HealthPlugMe with Lady K.
Yes, people. Bring it out.
I am so sorry, I'm not showing
out.
you much product here, but this is my 2-month fertility tea.
Okay.
I have my every woman combo, my fibroid
drama queen.
period herbs, ovulation booster, and full fertility kit, low sperm count herbs, so many other fertility herbs, women health stuff that I have. So even if you are having sexual problems, maybe you are having low sexual urge, you don't get wet, or you don't last longer in bed as a man or a woman, I have solutions to it. So make sure you contact me. I will put my phone number on the screen, and my social media pages will be there too, so you can give me a follow and contact me on WhatsApp.
Guys, I'm sure you've heard. It's not even I'm sure you've heard. You definitely heard, except if you want to be deaf, or you have blocked ears like blocked fallopian tube, but then I'm sure you don't. But then I'm sure you were all enlightening today. Trust me, you guys are going to be seeing Lady K's contact on the screen below. So in case you want to reach out to her, the number is on the screen. Check it out, guys. So like I was saying earlier, I'm sure you guys are being enlightened. I mean, trust me, I learned a whole lot. Like I was legit jotting. I'm sure you all saw me when I was writing, because I am also learning. And like I always say, by now you guys should be used to it. Learning is constant. The way change is constant, learning is also constant. So guys, please do tests for married couples. Make sure you do fertility tests too. If you know you're having problems getting pregnant in your marriage, both men and women, please do fertility test. And ladies especially, you've all heard what Lady K of HealthPlugMe has to say. So make sure you do all your tests, like everything, like tick it off your checkboard or checklist or whatever it is. Tick all the tests off your list to be sure that yes, you are fully healthy. Women have problems. God help all of us. Like, it's not easy to be a woman. So this is why I used to say, men, please treat your women right. If you're not treating your women right, you are wrong. And yes, you guys see, wait, okay, wait, you guys see, oh,
What is it?
wait, calm down. You guys, calm down. See, Lady K, she's wearing what? She's wearing her clothes. See, she looks like a nurse, like a proper nurse, even though that's a, obviously that's a practitioner. See now, the clothes she's wearing, Lady K of HealthPlugMe, the slippers, pink, clothes, pink, the chair she's sitting on, pink. I'm sure pink is her favorite color.
That's not my favorite color. Guys, that's not my favorite color.
That's what she always says, but everything is pink. Even what we are using to record this video, trust me, if only you guys can see it, it is pink. The only thing that is not pink on this woman's body is her wig, and she'll keep telling us it's not. It's a lie. It is pink. But man, that's not where I'm driving at. Where I'm driving at is patronize HealthPlugMe. If you need somebody to talk to, if you need to talk to a specialist, she is a specialist. And it's not even about trying to promote her, it's about testimonies that I have seen and I am still seeing. And if you think I'm lying and you do not want to believe me, go to TikTok, go and check her pages. You see that yes, a lot of people are in her DMs on top this women of fertility man. Even husbands are in her DM for their wives. So please, what are you doing? You have this free opportunity to get free awareness and you don't want to make use of it. Then something must be wrong with you. But then we are besties, right? Besties for life. So I trust you that you will do the right thing and live a very healthy and fertile life. All my listeners and viewers, in Jesus' name, you will give birth. Even me that is talking, I'll give birth to.
Amen.
We will give birth with ease. We are not
Amen.
barren. We are fruitful, and
Amen.
fruitful shall we continually be.
Amen.
Thank you guys for watching this episode. Love you. Bye.